The AIDIT is a framework made up of 5 behaviors that we can use to communicate with our patients, their families, and each other. The framework is effective for colleague to colleague, person to person. There are 5 behaviors that allow us to establish an immediate connection with our patients and their families. It allows us to express empathy in our first interaction by choosing to put them at ease. Remember, you only have one chance to make a good first impression. AIDIT stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. Let's start with acknowledge. Acknowledging a patient sets up a positive environment. We all want to be recognized. Acknowledge your patient by using their name. Let them know you think of them as a person, not just a patient or a customer. Include a greeting. Have you ever had a colleague who walked into the office every day without saying hello? Compare that to the colleague who says with a smile, "Good morning." When a patient enters a medical practice, acknowledge that the patient has taken the time to have their healthcare needs taken care of by us. Acknowledge family members and/or visitors of patients. These are the people who will continue caring and listening to our patients when they leave our office or when they are discharged. Acknowledging them lets them know they matter. Next, we want to introduce ourselves. Your name makes you more than one of the over 42,000 employees of our amazing healthcare system. Tell a patient your name after saying hello. It allows your patient to recognize you as a fellow human being. Provide your job title so that they know why you are there. Letting them know your background, training, or years of experience manages you up to your patient and assures them that they are in good hands and that they are safe. And remember, of all our values, it's safety first. In order to set a patient's expectations, it's important to let them know duration. Who can recall waiting on a subway platform before there were the LED signs announcing how long before the next train? 2 minutes looking down a tunnel seemed like 2 hours. Now that we know that it's 8 minutes until the next train, our expectations are set. When a patient knows how long their visit will be, how long a test will take, or how long the wait time, we are involving them in the process. After all, they are the ones being serviced. We've all encountered the child that asks why. Okay, but why? And why is it? And why is that? Inform patients of what you are doing, how procedures will work, and whom to contact if they need assistance. Generally, a patient's biggest fear of a doctor visit or a hospital stay is the fear of the unknown. Communicate any steps they may need to take. You are involving them in the process. Make words work. For example, the test takes about 30 minutes. The first step is to drink the contrast, and then we'll have you wait about 20 minutes before we take a blood sample. Would you like to read while you wait? The what and why reminds our patients of the commitment we make to resolve their health concerns. This is the explanation portion of AIDIT. And then there is the thank you. Think of the last time you held a door open for someone and they didn't respond. How did you feel? Unappreciated. Let our patients and their families know we are grateful that they have trusted us to be their healthcare provider. The AIDIT model does not have to be delivered in any particular order. It is a framework for us to remember the touch points that make service into service excellence. And the best part is, you can start practicing immediately. Remember, we use patient examples today to introduce the AIDIT model, but the framework is effective for colleague to colleague or person to person.